Hello, everyone. A great big thank you for choosing to watch the 2025 Rules of Engagement for Health Insurance Enrollment, Part 1. It's finally that time of year when you can enroll in the best plans during open enrollment because, as you probably know, when you enroll in plans after open enrollment, sometimes the better plans and pricing may not be available. But even if you enroll outside of open enrollment and you're able to, I can still get you amazing coverage as I've done for years. Now, if you're watching this, you're only watching it because I've enrolled you in a quality healthcare plan in the past. Now I'm making this video to help give you guidance and protection for 2025 plan year because there's a lot that has changed. Now, before I do, I wanted to share with you that a lot has also happened in the past 2 years with regard to me and my family as it relates to healthcare, which is why I haven't been engaging with you as much as I would want to throughout the year. My mom was had a metabolic illness that was diagnosed that required surgery last year. She was diagnosed on January 15th, and I dealt with that, or we dealt with that for almost all of last year. There was about 3 months or so that I wasn't able to work as I was constantly, being her caretaker. And then this year, in January, also, she was then diagnosed with colon cancer, which until recently also required all of my time and attention. I was splitting my time between working and taking care of her, but I still had to take a few months off this year as well. So it has been an insane and extremely exhausting 2 years for me. Obviously, this is why health insurance is so important because without it, the cost of all of these things would have bankrupted me. Okay. This is already the third time health insurance has pretty much saved my life and me and my family's financial life. That's why I love what I do, and I do it with passion because I also want to help others avoid the close calls that I've had to endure in just the past 4 or 5 years, because I had my own story as well a few years back. Now, with respect to the new rules and the regulations regarding the health insurance industry, that has also been insane and exhausting. Okay, but the bottom line is that CMS, which is the Centers for Medicare and Medical Services, has made the environment so much safer for consumers like you and legitimate insurance brokers like myself. I can tell you that these changes have gotten rid of and taken out of business companies and a lot of fraudulent agents. Now, typically, most of my customers each year would usually just send me a few text messages back and forth, and or we'll have a quick phone call. But this year, it's not going to be as easy. But see, once we jump through some of these hoops that CMS has put us through, which is a good thing, for the subsequent years after this one time, it should be as quick and easy as it has always been. The one big difference is going to be that your account, your insurance, and your medications, everything will be safer than ever. And you'll also have an easy online portal where you can make sure that everything as it should be, everything will be as it should be whenever you want to do that. And we'll get into that in just a moment. Now, let me just show you really quick. This is the channel, my channel, the What in the Healthcare.com channel. This is the YouTube channel, and it's important that you hear this out because it's really about who you're working with. So it's my mission to inform you about what health insurance is, why it is a lifesaver, and so much more. I'm passionate about helping people avoid thousands of scams and fraudsters that plague our industry. I'm also passionate about helping good working people and those that need help. Videos that instruct, provide value, and help you become a better, safer consumer in an increasingly more dangerous world is my goal in building what in healthcare. By the way, and for your information, if you want to search for legitimate government benefit and assistance program, this is the only site that you'll need to visit so that you don't get tricked. And I lay it out there. It's www.usa.gov. And if you want to look specifically for the benefits in your state, you put a / benefit hyphen finder. If it's not a if it's not a .gov site, it's not a bona fide government website, aka it's just not real. Like all those ads and all those websites you're going to find when you're going through and advertised on Facebook, TikTok, Instagram, all those. And right now, since it's open enrollment season, you will be seeing those ads and all those offers for free money and giveaways. I mean, just you name it, whatever you're seeing out there on TikTok and Facebook and Instagram, stay away from those ads, folks. Okay, they will bring you nothing but trouble. Some links here. This is the my website, the original whatinhealthcare.com. This is the new enrollment site I'll be talking about in a bit, and the Trust Pilot, which I'll also be talking in a bit. That's actually what I opened with. But let me just go here and take you to some of these government sites just so you have an idea. Now, here's the government, or actually the USA.gov. Okay, this is again find government benefits and financial help. That's one of the main things they do. And there's the benefits over here down the bottom. You can check here in your state to see what works for you. Again, I kind of also went through this CMS.gov site, and you'll see that all these sites say an official website of the United States government. That's what you want to see. Whenever you see any ads for money or something like that, I mean, if it just doesn't have this, or it's not a .gov site, just stay away. Okay. Now, here is the so CMS, it oversees Medicare, Medicaid, and also it also oversees what we do or what I do, healthcare.gov. Again, .gov, an official website of the United States government. So you can go on healthcare.gov and you can enroll yourself, okay, without me. But I don't recommend it. Here's why. On healthcare.gov, you're at some point going to be confused as to maybe what you should do, what you should select, what you should enter. And even if you finish, you will never have a relationship with anyone that can honestly help you. You can call their center. It's 24 hours a day, 7 days a week, which is very convenient. But you have to keep your fingers crossed that the agent that's going to answer your call at that time, whenever that may be, will A, kind of know what they're doing, and B, that they're not one of the fraudster agents that have led to all these changes, because the agents that, even though you're going to call the healthcare.gov site, you're not going to get any agent that works for the government or anything like that. It doesn't work that way. All those calls get forwarded to a call center, and basically you are enrolling at your own risk and working with that agent at your own risk. Now, if you haven't watched part two, that's the part two is the test drive for my newest site, which is gill-insurance.com. Okay, I'm going to go ahead and help you with that part so that you can easily enroll yourself, and you can also have me help you with questions, giving you one-on-one attention. As a matter of fact, if you get stuck, I'll be able to help you. I'll be able to send you a link. So go ahead and make sure, if you haven't watched that, to go ahead and click on the link in the bottom here on the description so you can watch part two of that. And again, that is going to be the 2025 Rules of Engagement for Health Insurance Enrollment, Part 2. And folks, if you've made it this far, thank you. And but by the way, if you still don't recall who I am and you want to make sure I'm a real person and that I'm not a fraudster, just go to trustpilot.com. Okay, that's it right there, trustpilot.com, and just look me up when you get there. All right, this is the homepage, and then all you gotta do is just type Gil and then insurance, okay, or actually Gil Grisales, whichever one, I guess. But insurance seems to work too. And boom, you can click on that. And there's my trust pilot. Now, granted, I don't have a lot of reviews. They're just 12. It is really hard to get reviews from even people that are my lifelong fans. I don't like to bother them too much. I send them one reminder maybe, and that's it. Now, but I do have 12 reviews. I urge you to take a look at it. All of them are 5 star. And I think it'll give you great insight into how customers feel about me. These customers are from all walks of life and from at least 27 different states, okay, that I have customers in. I have licenses in over 27 or about 27 states. So please read through them, and you'll see that there's just a lot of very, very happy people. This is the page I actually started the video with, just to give you a little bit of I don't know. I just guess more reassurance because again, I know there's a lot of scams out there, but definitely check it out. And I hope you have found the information that I've provided for you here informative. I hope it helps you, your loved ones, friends, neighbors, coworkers get a lot of referrals. Share this with them so that they can feel safer and more comfortable about how easy this process can really be. And I will walk them through it step by step. I'll look forward to getting you life saving and financial life saving health insurance for the upcoming new year and for many years to come, as well as building and growing a community that provides value, which compounds over time. Remember, you can go ahead and just save my local Miami number. Okay, and also feel free to save that toll-free number. Okay, in case I send you messages from there, you just know it's not a stranger. Otherwise, happy holidays, everyone, and I can't wait to help you secure your health and your wealth in 2025. Thank you.